And here we have a brief video consolidating everything discussed with regard to patient reception. You'll note here that our duty dental technician, played by Warrant Metcalf, is protected by safety glasses and a Type 1 mask. This is recommended whenever physical distancing policies can't be respected at all times in the workplace. That is, when a 2 meters distance can't be respected at all times. It should be noted, however, that the mask must be exchanged at a minimum every 4 hours. Our patient, played here by Corporal Maldonado, is directed to the hygiene station, where she follows directions to carry out hand hygiene, don a mask, and repeat hand hygiene. Once complete, our dental technician will take our patient's temperature. Our medical colleagues have lent us an infrared thermometer, which permits us to maintain maximum distance while obtaining temperature. If the patient is confirmed afebrile, defined as a temperature below 38 degrees Celsius, she is directed to take a seat until the duty team is prepared to receive her. You'll note that our reception area has been cleared of all non-essential furniture to facilitate distancing. You'll note that when our duty dental officer, played here by Captain Lee, is ready, he too is protected by mask and glasses and respects physical distancing while directing the patient to the operatory. Outside working hours, we conduct business a little differently. We receive our patients at our rear staff entrance, where a vestibule permits us to maximize physical distance. A wash basin and soap, visible on the left, and a cart with an alcohol-based hand rub is placed here. Again, the patient carries out hand hygiene, dons a mask, and carries out hand hygiene again. And, once her temperature has been cleared, the member is escorted at an appropriate physical distance to the reception area. This final video illustrates the procedures that our patients execute before and after treatment. Before all high-risk aerosol-generating procedures, our patients don a Type 1 gown, which has been laid out for them in advance, following which they will discard the Type 1 mask they will already be wearing. Having discarded the mask, they will then rinse with a hydrogen peroxide rinse, which has been laid out in advance on the dental tray alongside 3 sheets of Kleenex. These are used to absorb the fluid, and the garbage is sealed in a Ziploc bag and discarded by the patient into the garbage. The patient is now ready for treatment. Treatment complete, safety glasses are discarded, and the gown is removed under the direction of our personnel, taking care not to agitate it unnecessarily. Then hand hygiene is repeated, a Type 1 mask which has been laid out in advance is donned, hand hygiene is repeated again, and the patient is instructed to wait for our personnel in our reception area. And now we present a video that touches on the central topic of today's discussion, transmission-driven personal protective equipment. We'll touch first on the sequence for donning low-risk and then high-risk PPE. As discussed earlier, we've established a dedicated PPE bay at Det Borden, which provides a dedicated area for donning PPE some distance away from the areas where we generate aerosolized particles. As you can see, we've arranged our PPE in the sequence in which items are donned, with aide-memoirs placed conspicuously to guide our personnel. Our detachment, as do others, perform quarterly hygiene audits, so we expect that our hand hygiene technique is sound. All the same, we've placed guides to hygiene with both an alcohol-based hand rub and soap and water at the sink. Sanitizer does effectively kill the virus, but it's recommended that proper hand washing with soap and water be substituted for sanitizer approximately every 3 washes, or if the hands are visibly soiled. We begin with the sequence for low-risk PPE. Gowns serve to protect both skin and clothing and should cover both. The gown should cover both the front and back of the torso, extending to at least the knees and fitting comfortably over the body with long sleeves that are fitted at the wrists. Goggles should fit snugly over and around the eyes. It's not acceptable to substitute one's personal glasses for goggles, and the goggles selected need to be side-vented. Once mask and goggles are in place, it's essential to limit any opportunities for touch contamination. Don't touch your face or touch PPE with contaminated gloves if it can be helped. Remember to perform hand hygiene again before donning your gloves. Ensure that the sleeve of the glove is fitted over the sleeve of the gown. Once both members of the duty team are suited for battle, we conduct a buddy check to ensure that everything has been placed correctly. And now we demonstrate the sequence for high-risk PPE. You'll note that our duty team has already completed hand hygiene, placed booties, and is now hand washing again. They will now don a Type 3 surgical gown. Please note that subsequently in this video, one of our providers will don a surgical mask, vise, and N95 mask, as we wanted to minimize the number of masks used in the production of this presentation. Both providers must wear an N95 mask if it is anticipated that aerosols will be generated. Note that Captain Lee verifies that the N95 is correctly sized before donning the mask. You will note the placement of the straps, that they are not crisscrossed. You will note that he molds the mask to his face and, having done so, conducts a fit test. Our providers will next don goggles, a bonnet, and a face shield. Surgical gloves will be used in lieu of examination gloves for high-risk procedures. Again, ensure that the sleeve of the glove is fitted over the sleeve of the gown. Again, we execute a buddy check before proceeding to the operatory. This next sequence will see our treatment complete and a provider prepared to remove PPE. A provider moves first to the doffing station adjacent to the door, where an aide-memoire will guide removal of personal protective equipment. As you can see, booties are removed first with gloved hands. Following this, with gloves still on, the gown and gloves are removed simultaneously if possible. Following removal of these contaminated items, hand hygiene is repeated. Now our provider will remove the bonnet and the face shield. You'll want to remember to grasp the rear of the bonnet and the strap of the face shield, as these are the relatively clean surfaces of these items of PPE. Before opening the door, hand hygiene is repeated. And it's important to remember to close the door behind you to contain any suspended viral particles. Our provider has moved to the secondary doffing station, where hand hygiene is repeated. Eye protection is removed by the straps, not the facial aspect, and placed in the disinfection bin, as these are intended for your use. The N95 is removed by the straps and not the facial aspect of the mask, as the member does here. Hand hygiene is repeated, and a Type 1 mask is donned.